About this meeting, this is a joint meeting, the EADO meeting and melanoma and skin cancer centers meeting. And I have to say that we are really happy with the attendance in Barcelona. It's probably the best meeting of the year in terms of skin cancer, being of course very focused in skin cancer issues, and covering from issues about early prevention, early detection, prevention, of course, management of the patient's treatment, prognosis, and including in the program the participation of patients advocacy and associations of patients it's very essential, and also nurses. And this is something that we want to promote in the future as well, because patients are in many times treated by nurses, and they are very close to patients, and nurses are not participating in so many of these meetings. So we consider that it's very essential to keep the education of nurses in meetings like this one. We had 1,100 people attending in the end, with more than 100 speakers involved in the meeting, so this huge number. A huge number of symposiums, parallel sessions, about 200 abstracts presented with very good research in skin cancer. And something that is very unique, I have to say, is what we call breakout sessions. That it's a forum for discussion of particular problems that are not present in most of the medical meetings, like access equitance to treatments, or how to manage a skin cancer center multidisciplinary board meetings, how to run databases that are very essential, biobanking, many issues that are in the program with the intention to export models that have been successful to other centers in the world. From these conferences, these breakout sessions, we have formal discussions in smaller groups, and then we have the reporting of these breakout sessions in the plenary during the morning with all the auditorium full. And that's what was very, very interesting. Today we had breakout sessions about how to manage big databases, how to organize the information in skin cancer centers, how to connect different departments, and issues about accessibility of this data that are in the end very essential for the management of patients and for the translational research, with challenges about biobanking and other issues. We had also reporting the conclusions about how to facilitate the access and equity for patients in Europe and worldwide to innovative medications. That is really a challenge that we have today, very evident. So there is a disparity of the access to medications in Europe, depending on the country where the patients are living, because the medications are not approved in that country, or they are not reimbursed, or because there are some delays in the time when the medication is approved in Europe by EMA and with indication, and the time that the governments decide to cover the cost of this medication. So access is not possible during a long time for these patients. And in some other countries, many other issues are very evident. So medications that are very useful for the treatment of high-risk patients or patients with metastases are not available actually in Europe. There are many exciting things to consider. From prevention, what seems very clear is that we are able to improve early diagnosis of skin cancer with the knowledge we have in medicine, but still we have a delay in the early detection of cancer. So patients having melanoma are having the diagnosis too late. And this is very evident today in many situations. So the disparity I was telling about, it's very evident also in early detection because of many reasons. One is education, so we need to improve education of the population, and access to medical care from the beginning. It's very clear that what we were doing in prevention for skin cancer, that means primary prevention, basically avoid UV radiation as far as possible, because this is the main reason for having this epidemic of skin cancer, was not very successful. We could explain the population and educate the population about these risk factors. They know about sun damage, they know about sunburns, they know about skin cancer, but they are not changing their habits. Okay, so, and this is something that it's really very clear. Mortality, even with this knowledge and the new therapies we have, is still flat. We are not changing in most of the cases mortality rates in melanomas, what is really a challenge. And the reason for that is because we have still delayed diagnosis of skin cancer. That's very essential. Then in terms of diagnosis, we have very good news, because we are implementing new tools for early diagnosis that probably will be exported in real life for the clinical practice from the users based apps for early detection of suspicious lesions in the future. It's fascinating how artificial intelligence is evolving in general, but particularly in medicine. And today it's very clear that we don't have tools to replace doctors doing diagnosis, but probably computer vision will help in many of these challenges in the future. We were discussing about this. We have today different tools that are supposed to be replacing doctors very soon, and it's evident that this won't be the case, but they will help us in many situations where we need fast tools for detecting suspicious lesions. We have today diagnosis that can be done in very early lesions that were impossible to be detected in the past, using microscopes and other technologies that are really useful. We can detect population at risk for skin cancer and melanoma because we know much better the genetic background for these risk factors, and we can identify high risk populations that benefit from strict follow-up. And this is well known based in genetic counseling and some of this genetic testing that we can do today in skin cancer. We have, of course, very good news for the treatment of patients when they need that treatment with innovative therapies that have been proven to benefit these patients, even at the adjuvant setting in melanoma or in a more advanced stage in melanoma and in other cancers. And this includes many things like immunotherapy or target therapies, or the combination of different of these new innovative drugs. Of course, these are very good news, and we are able to improve survival in metastatic patients that was considered impossible just a few years ago. However, we need to think in skin cancer globally and understand what are the gaps that we need to cover in the future. Yeah, we you know, always we have the intention to say no, and in 2025 we will have no melanoma mortality. But unfortunately, this is very difficult and challenging because cancer is a very complex disease, and even if we understand better every single tumor, not just melanoma, differently of other cancers, but particularly the tumors in every patient. We understand that this is very complex disease, and means that we need to fight. Probably in the next years we will be able to improve the number of patients surviving with advanced disease. We hope so, but it will be very difficult to cure all the patients having metastasis. For that reason, we need to fight from the beginning in early detection, of course prevention, early detection, and of course again the treatment of advanced patients. I think that I want to say that it's really fantastic to have so many people engaged in this battle against cancer from different perspectives, and I think that this should be the way to beat the cancer in the future, and skin cancer in particular.